Hello, I'll tell you about acidity or acid reflux, or in medical terminology it is called as gastroesophageal reflux disease. This being a very common condition, I have explained in detail, and so I have taken in 4 parts, part 1 to part 4. In part 1, I'll give you a small introduction where I'll tell you the importance of the presence of hydrochloric acid in the stomach, and those who have acidity, what are the aggravating factors. In part 2, I'll concentrate mainly on the patient complaint and when the doctor examines, what will be the findings. In part 3, I'll tell you about the necessary investigations and its findings. The last one, part 4, the most important one, I will detail about the treatment. That will be divided into 4 classes. In the first one, I'll tell you about the lifestyle modification. The second one is about diet, in which I'll cover what all food to be taken, what all foods to be avoided, and about home remedies. And the third one being the medicines. Fourth one is about surgery, and the last being a small touch about yoga. So this is part 1. So I'll tell you about I'll give a small introduction and tell you about the importance of hydrochloric acid. So in this picture, you can see the stomach. So hydrochloric acid is being produced in the stomach. It is very important for the normal digestion of food. So if you see the structure of the stomach, so those who have acidity, either it is the increased level of hydrochloric acid, 1, 2, the lower esophageal sphincter is relaxed, which I'll tell you in detail so that you can understand. This is a food pipe, here this one, and this is the stomach. So food pipe, upper end, there is a small door like structure which is called the upper esophageal sphincter or cricopharynx, and the lower one here which is near the stomach, it is called as lower esophageal sphincter. So usually this lower esophageal sphincter, it has got a resting pressure and it is in a closed position. It opens up to allow the food which is present in the esophagus or the food pipe to pass it into the stomach. So in those patients who have acidity or who have reflux, what we have seen is the lower esophageal sphincter is relaxed so that the acid can easily reflux into the esophagus. That is the second point. Third point is, in these patients, for some reason or the other, the intra-abdominal pressure is high. So what happens? The contents of the stomach, it regurgitates. These are the common reasons for acidity. Now let me tell you the importance of acid. The presence of hydrochloric acid is very important. I have written down so many, but I'll give importance to 2. The first action or the more importance being protection. It is an acidic media. It is highly acidic. If you see the pH, the normal pH is 6 and 7. The lowest pH is 1. The highest pH is base, which is 14. Lowest being 1. So hydrochloric acid, which is present in the stomach, it comes in a range of 1. So it's so acidic that if you take a drop of it from the stomach and put it over a razor, it will just melt it off. If you put it over the hand, it pierces the hand, it will come to the other side. It is so strong it is. Now this acid, hydrochloric acid, which is in the stomach, the most important function being protection. So anything which enters, unwanted thing which enters the body, either through the mouth or nose, finally which reaches the stomach, it will be removed by the protective action or the pH, because of the pH of the hydrochloric acid. The second important function is, it helps in digestion, and the most important being, it starts the protein digestion, which needs acidic pH. These are the 2 important functions. So the presence of hydrochloric acid is very important, and the stomach itself is protected by the action of hydrochloric acid because it has got a covering of mucus which is produced by the mucous glands. So here I would like to tell you that gastroesophageal reflux means reflux of material from the stomach into the esophagus. And the common pathology or the causes I have already mentioned. That is the lowering of the pressure of the lower esophageal sphincter is low because it is relaxed. intra-abdominal pressure is more in conditions like obesity and pregnancy. Now, let me tell you in brief about the aggravating factor. Those who have acidity, what are the aggravating factors? Oily foods, deep fried food, smoking, chocolate, alcohol, coffee, chewing gum. These are the common aggravating factors. And those who are really stressed up in work and they are too much of strain, those who are on regular medications like painkillers, on steroids, and a few antihypertensive medicines like nifedipine, propranolol can, and asthma in those bronchodilators like salbutamol can have effect on the lower esophageal sphincter, so it can aggravate the gastroesophageal reflux too, and hypercalcemia patients. Not only that, if those who don't have time to take their meals at the right time, so they have irregular food habits. And of course, I have mentioned that pregnancy, the gastroesophageal reflux increases because of the intra-abdominal pressure and the relaxation of the lower esophageal sphincter. Now, hiatus hernia is a condition where you have a hernial protrusion like this. In this condition also, this can aggravate the present condition. So, these are the common aggravating factors. So, in summary, if you ask me, I will tell you the common reason being hurry, worry and curry. These three things can aggravate the already existing reflux. So, this is in short about acidity, a small introduction and the common aggravating factors. So, please do watch the second part where I will deal with the common patient complaints and the examination findings. Thank you so much.